The topic we are going to discuss today is how COVID is impacting with severe mental health conditions and what to do. My name is Gerard Mijon. I'm with the Clarity Child Guidance Center, and we look forward to an engaging conversation with our speaker, Carol Carver, who is the COO and the Vice President of Patient Services at Clarity. For those who are not familiar with our organization, Clarity Child Guidance Center is a nonprofit treatment center solely dedicated to helping children 3 to 17 with their mental health. Clarity is a center in San Antonio and provides inpatient and outpatient services to several thousand of children every year. You can read more, of course, about our center at the Clarity Child Guidance Center website, claritycgc.org. And also you can learn about children's mental health on our prevention and website, 1-5minds.org. Before we start, I have a few technical details I want to cover. First, the webinar will end at 11:30, including a 10-minute Q&A at the end. This talk is recorded, but none of the names of the attendees will be showing in the recording in order to protect your privacy. So that's also why we are not taking live questions. However, if you have questions for Carol, we really encourage you to post them in the Q&A or in the chat space at any time during the talk. And you can address it to centers, or if it's not private, you can send it to everyone. Of course, this event is pure and is by no means an attempt to provide counseling online. Carol Carver is joining us from her office, and as a COO, she has responsibility over all Clarity programs, but most importantly, she brings 38 years of nursing experience in the field of psychiatric care, mostly in inpatient treatment. So Carol, welcome.
Thank you, Gerard. Good morning.
Good morning. Great to have you this morning, and we welcome all the parents and professionals maybe that are joining us this morning for this important talk. As all of us have known, whether we have family members or student or patient, we know that these last 6 months have been very difficult, very stressful, even for young adults or our children who are in a very good health. But for students or for patients who have a mental illness, this is even more dramatic, I would say. And so, Carol, can you tell us a little bit what you've seen in terms of how COVID has impacted children who have a mental illness?
Yes, Gerard. As you mentioned, this has been a very stressful time for everyone. But for a child that is having behavioral health problems or a mental illness, it can be extremely challenging. Our children struggle to manage their symptoms, and when they're under additional stress, the management of the symptoms or the behaviors becomes even more difficult. So we do see more of these behaviors in the children.
So, for example, can you, did you see a change in the type of response from these patients, or the acuity of their response?
I think that I just see that our children are more fragile. They're requiring more support, more structure, and needing a more reassurance and a sense of security that they're going to be okay.
Yeah. Now, of course, in this context, access to care, in general, so outside care for COVID patients was more complicated, and it's access to care in mental health is also as sometimes difficult. So, how has access to care during COVID to children's mental health care changed?
Well, as with all areas of healthcare, parents are reluctant to bring their children in for care. If they are receiving telehealth services, this doesn't always work for the much younger child with a lot of distractibility. But for children that need to be assessed in crisis, it can be very, very scary for a parent because they're worried about bringing their child to a community setting and they're at risk of exposure for the child. So we are doing everything we can to reduce that risk, but it still can cause some increased anxiety in parents.
Right. So the services are available, whether it's telehealth or inpatient and crisis. It's just there's some fear about what is going to happen when the child is or the family comes to the center, right? That's what
Right, and it's extra difficult for children because many children are asymptomatic when they're positive.
Yeah. Now, in this context, of course, having a crisis plan is critical. And so especially when you have a child who is fragile. Now, can you explain a little bit what is a crisis plan and what are some of the key parts of it?
A crisis plan is a step-by-step approach to managing a child's symptoms when the regular interventions or the typical interventions don't work. So this plan is usually developed by both the child, the parent, and a healthcare provider. And it pretty much works like this. The parent does their usual intervening with a behavior, and it's ineffective. So the child continues to have problems, the problems begin to escalate. And so that's when you would want to implement your crisis plan. An example of a crisis plan is to have someone available that can provide additional support and help. Maybe this is another family member, maybe it's a neighbor. And then as the crisis escalates, if the interventions don't work or are not effective, you have to have that last step of accessing emergency services.
So imagine you have the key numbers of your providers and someone who can access. So that's always the challenge is, so if this doesn't work, you have to have other options.
Right, because during a crisis, you can become more overwhelmed as a parent, and it's better to have something in place so that you can follow that step by step, and you're not trying to figure things out in the moment.
Yes, absolutely. Now, I want to remind our attendees that they can ask questions at any moment. So if you're an attendee here, post your questions in the chat or in the Q&A, and we will go ahead and cover those questions toward the end. Now, again, in this context, how would you say parents can make sure they can get access to the care they need for their child?
I think the most important thing is to understand what's available in the community, to educate themselves on what providers will meet the needs of their child. And if they have questions about that, to ask those questions early, to not wait until there's a problem, but to research and understand the system of care that's available to their child. And this system can be very complicated. So it's very important that they ask questions ahead of time. They can come and tour a healthcare facility so that they have a good idea about what's available to their child.
And so you mentioned in question, what are maybe some key questions they should find out about that, in terms of the providers?
Well, I think key questions are, who in the community provides care for children, because there are some community providers that don't have any child services. I think other key questions are, how do you access these services? What numbers do you call? What questions can you ask? And I think that everybody can be educated on how to navigate this system.
Excellent. What would you say now, in terms of, you work with a lot of families, and if you have a child who has chronic mental health issues, and there's a lot of precautions and kind of that changes the whole family and the dynamic. What would you say are some changes that these parents can make at home to help their child more in this context? So thinking of especially the COVID context, right?
Right. Well, we're all under more stress right now. And so I think what's really important is to have structure and predictability in the home. However, it's very important to not make the structure the priority, but to make the behavioral health the priority, or the problems the priority. In other words, you have the structure in place, the child is following the routine, but when they become overwhelmed or stressed, you want to take a more flexible approach and maybe provide an activity that's more relaxing and calming for the child. I think we have to give ourselves permission to put the child and our mental health first.
Yeah, so that's really important. Is you're mentioning like self-care basically, right? As a parent, again, what time for. So there is a time for the structured activity, whether it's school, and then there are obligations and goals, but at the same time balancing that with time for relaxation, or having good communication with and self-care, as well as time for yourself. And because if you don't have the stability or the strength to help with the child, it can be very overwhelming. What about, so if you think of schools now, again, parents having to adjust to the changes in school, what would you be your advice to parents in that regard?
Well, I think for school, I can't stress enough that school is important for the growth and development of a child. But when we're struggling under these very stressful conditions, we need to balance that with making sure that the child feels comfortable and secure. Whether your child is attending school at home or whether they're actually attending school, we need to make sure that we're checking in with the child, making sure that they're getting enough support to manage the change, because this is a very big change for children. And if they are attending, whether they're attending at school or at home, we need to maintain open communication with the teachers and with the education system.
Yeah, and we've seen that school really putting a lot of efforts, making a lot of efforts to adjust and engage with families. I've heard even also that actually because of the the remote engagement of students, so parents actually were getting more involved, and teachers were able to talk to parents more frequently. So it's an opportunity actually, because it changes the way teachers and students communicate, that parents can have access to teachers to express their concerns. Now, I have a really interesting question in this regard that one of our attendees is asking. My ADHD child is extremely afraid to leave our house, especially returning to school because of COVID. What can I do to help him become more confident, or that question moved away, but basically, how can this parent help their child to overcome these fears?
I think it's important to reassure the child of their safety and to offer the child the ability to protect themselves. So in other words, you can tell the child, you're going to be wearing a mask and this is going to help, and you're going to be keeping your distance and this is going to help. I think the child needs that reassurance of the concrete things that they can do to keep themselves safe. So it's really important to let the child know that they can help themselves by taking these precautions.
Yeah, that's a good way to basically show concretely and engage the child, and maybe even take them do a run through, just to get them to
Practice.
see
Yeah.
to see exactly what is going to happen, even outside a regular school hour if possible. Now, what about, you mentioned the self-care. Could you explain a little more what you think about, or what you mean by in terms of the parents and the siblings, and how they can become more adjusted to this and stronger, because like we said, that the entire family would be experiencing the issue or affected by this?
I think the most important thing is to identify what we enjoy and to make time for what we enjoy and what relaxes us and makes us feel better. And I think sometimes we lose sight of that when we're caring for others. And so it's very important to care for ourselves like we would care for our child or for a good friend. So to treat, and I think you have to instill that in all family members. I think parents need to take time for the other children in the family and actually do that in a very structured way. Say this amount of time is set aside for this child, and really make every effort to adhere to that identified time. So everybody has a predictable amount of attention and attention to self as well.
Yeah, so that's essential. And do you have a maybe concrete example of what you've seen families in good and maybe not so good ways of how this uh, approach will have impacted the family?
I think something as simple as just calling a friend and having a conversation with a friend, having that ability to share experiences, to share stories and stressors. I think that, as a community, we can support each other. And just because we can't interact face to face doesn't mean that we're limited in our interactions. And I think it's important not to isolate ourselves.
A question also that's coming up is the question of medication and access to. Have you seen any changes or do you have any recommendation of that during COVID? Were there any issues that have come up because of it? And
Well,
what to do?
what I've been very, very pleased with is that physicians have been very flexible in their prescription practices.
Right.
So, in other words, if a family can't make it to an appointment or because of additional problems with exposure, they're not able to see their physician, physicians are very willing to refill prescriptions when they haven't seen the patient. And so I think the flexibility on the part of the providers has been critical. And I think we've done a really, really good job in the community of responding to that need. Because let's face it, the medicines are super important.
Right. Yes. Thank you. Now I have another question from an attendee. It said, how to help teenagers demonstrating the symptoms of social anxiety, both online and face to face.
The children that are experiencing anxiety are an extra challenge because we are all anxious. And if you're already having a struggle with anxiety, this can add to that anxiety. And I think, again, I can't stress enough, just reassuring children of the facts of what they can do to prevent their exposure and to prevent their risk. And I think teenagers are really struggling because teenagers' development depends very, very much on social interaction.
Right.
So I think using Zoom is a very, very good tool for teenagers to interact in a group and have that social support.
Yeah, a related question, a parent was asking about their child not being able to sleep and because of anxiety. So any advice in terms of, sleeping pattern and helping a child with that?
I think exercise is extremely important for a child to sleep at night. And I think sometimes we don't get enough exercise if in this current environment. So if the child can do a little bit more physical activity and have what we call good sleep hygiene. Good sleep hygiene means that as you approach bedtime, you follow some relaxing rituals, such as reading. It's not a good idea to watch a lot of television right before you go to sleep. It's not a good idea to play video games right before you go to sleep because these are all stimulating activities. You want to dim the lights, do something relaxing. Even warm milk or hot chocolate can relax a child. And I think those are all things that you can do to help a child relax before sleep.
Yeah. Now, have you seen where parents were having trouble with the school and you know, maybe because of the child's behavior and so imagine a scenario where a child may have been in trouble at school and then they get some treatment and now they have to go back, right? Or can you tell a little bit about the process and how to make this possible, because there is probably a lot of anxiety on the parent side and maybe on the school side. What's the best recommendation on that, for that?
I think it's very important not to be overly coercive in the situation, to give the child time to adjust, to take it step by step, because I think sometimes a parent's anxiety over school can be transmitted to the child. So I think we need to again give ourselves permission to take good care of our mental health, to take good care of our child's mental health, and transition the child in a step by step manner where they can begin to get used to the idea of attending school again. And communication. Communication is critical
So communication with
with the
the
teachers
counselors, the
and with the
teachers.
child. Yes,
Right,
all
right.
communication all around.
Yeah, yeah. I think you know, more and more. I would say the teachers and counselors are you know, informed and able to help the family. I think there might be a little fear about that, like, you know, as a parent, and you know, what is the entire school going to know about this, or how does the school handle it? But you know, which matters a lot.
Yes, and I think the stigma of behavioral health and mental illness is still present, ever present. So parents might be reluctant to disclose the difficulties. But I am amazed at how much difficulty high functioning children are having right now. So
Mm-hmm.
this is happening pervasively with children that never had a behavioral health issue.
Right,
It's tough. Children are struggling.
right, yeah. Well, I have another, I mean, on the same theme of anxiety and Zoom, my teenager is anxious, is not comfortable with the Zoom class. She's not self-disciplined to do the self-pace and has become very behind and is not comfortable to reach out to the teacher. I'm not sure how to guide her to or help her. What can you say to this parent?
I imagine this can be very frustrating and this can be very anxiety provoking for the parent. Again, I can't stress enough that we need to give ourselves permission to support the child. Yes, some children may get behind, but I anticipate that the schools will be working on that with the child in the future. I think many children are not doing well in remote learning. And again, children that don't even normally have issues with school are having issues with school. So I think we need to recognize that and as much as possible talk about that openly.
So encourage the child to go back to not to in-person schools, as basically. And
Right.
what you're saying, yeah, yeah. But it creates a context, and it really, the social interactions that happen in the context of the classroom or the school are very positive, typically for a child. Now, there are exceptions again, that you know, with children who have some unique issues, but no, good. So I'm looking if there are other questions. Um, can you offer these services to San Antonio Police Department and Bexar County Sheriff Office? Well, we work with a lot with the law enforcement in San Antonio, right?
Yes, that's correct. We're part of a community effort to make sure that when there's a crisis, a mental health crisis in the community with where a child's involved, that that child gets to the right service.
Yeah.
And so we're working very closely with the emergency services in the community to make sure that the child gets directly to the people that will be the most helpful.
Yeah, yeah, because they're sometimes the front line after school teachers. They're the front line people, and it and you know, to be honest, there are still stigma. I mean, there are still people who don't understand children mental illness and don't respond, very well necessarily. And so that's something we're all trying to fight by educating parents, educating other professionals about children's mental health. And that's where also we mentioned, we recommend people to go to the oneinfiveminds.org website and share the information on from that website, because that's a tool that we've used in the past 7 years to really change the culture and the understanding of children's mental health in the community, with a lot of good impact. So we're excited about that, but it's an ongoing process, and we're never done with that. Any other a recommendation you would have in terms of just the relationship with parent teachers to make sure the transition back to school is positive? Are there certain, based on a child who may have put himself at risk of harm or others, how can a parent be more effective in terms of communicating, giving reassurance to the teacher and helping the teacher navigate this return to the school?
I think the communication is key, Gerard. I think that that plans need to be made, and if those plans don't work out, we need to plan again and always be striving for the plan that will fit best for that child. I think that if there's a crisis situation, it's important to recognize that and to intervene early and not wait until a child is in danger.
So what maybe some specifics about what a parent can tell the teacher to be prepared for, or how to, what would be some practical information that the parent should tell the teacher?
I think that the parent knows their child the best. And so the parent is very, very critical and key in conveying specific things that the teacher may see in the child's behavior and how the parent recommends that the teacher handle that. I think they can identify triggers for the teacher, and I think they can also let the teacher know what works best for their child.
Good. I have a question concerning Clarity here that just came up. With regard to emergency services at Clarity, has the accessibility to these services changed with COVID? Is it possible to drive up to the ER? We don't have ER, but to drive up to the crisis services at Clarity?
Yes, but I guess I'm a little confused by the term drive up.
I guess it's just walk in.
Yes, absolutely. I would say between 60 and 70% of patients that are treated in our crisis services are walk-ins.
Okay.
So that is a very, very good way to access services.
Yeah.
And now we have screening procedures so that if a child has a fever, then we make sure that they're isolated from the rest of the population so that we can treat the child in crisis, but also keep everybody safe.
Okay. Yeah, that's essential. That really we're set up for, and I just made a lot of changes because of COVID, but we've not stopped providing services during all this time. So
we can't stop because these are critical services that that can be emergent.
Yeah. One last question that I see in the chat is what about when the child actually is experiencing challenges at school, like bullying situation, and that cause him to go into a crisis? What's your recommendation in this context?
Well, I think depending on the level of the crisis would be would determine what response we would make to the crisis. But I think early identification of bullying is very important, and then managing the situation with the child immediately. I think sometimes children are very hesitant to disclose that they're being bullied. So I think it's important to really thoroughly assess when you see a child decompensating, to get at the root of what the decompensation is about.
Okay, great. Well, thank you, Carol. We're at the end of our talk today. Really appreciate your help in answering all these questions. Thank you, everyone, for being online today. We had a good group of parents who are really happy to be with you all. Join us next week. We are going to have our medical director, Dr. Gonzalez Vega, who will talk to us about how to make the most of psychiatric care when it's virtual. And again, thank you all for being here, and we will see you next week.